So in light of the current global injustices and levels of inequality affecting even healthcare in many countries, understanding the healthcare system as a human right has become even more critical, especially on the African continent. Let's unpack this further now. Bring in Dr. Tlaleng Mofokeng, United Nations Special Rapporteur. Good to have you on the program, Doctor. So I was looking at something written by the African Centers for Disease Control ahead of this conversation, and they were talking about how the health sector on the continent is facing a financing crisis. And you've seen firsthand, not just in our context here at home in South Africa, but in other parts of the world, just how devastating that can be. And I think that's a good place to start for our conversation about Africa in particular.
It's very important because many African nations have struggled to put themselves on a sustainable funding path that actually is supported by domestic funding in the form of tax and other donors which are domestic or nationally based, which means that many health systems for very important programs rely on international donations and aid, which is in itself unsustainable. But as we have seen, it's also part of the geopolitical affairs of the world. And so one of the first things to really feel that is health and the health sector.
And you've always emphasized the message that healthcare should always be regarded as a human rights issue and not a commodity. But at a time when so many countries are underspending in terms of their budget share for healthcare, what's not clicking? What are they missing? Are they not funding healthcare adequately because they can't afford to, or because they underestimate its value and importance?
I think one of the obligations for any state is that they should have a sufficient recognition of the right to health in their national political but also legal systems. And some of the countries actually still don't recognize the right to health as we do in South Africa under Section 27 as a human right. So for them, by default, it's always going to be seen as a private sector issue. And of course, the risk is that health and the right to health is commodified. But the other important thing that's missing when you don't recognize the right to health is that you are unable to actually meet the minimum core obligations, which means that you actually do not have a budget to support the progressive realization of the right to health. And that's possibly one of the big things, is that without a legislative framework, without a legal system that has accountability embedded within it, it's very easy to keep shifting the target to say, well, there are more important things, there are more emergent things, which is why I make the argument always that, especially for the Africa continent, it is important to look at diarrheal diseases. It is important to look at those, what we see as the basics of primary health care. But we really need to understand accountability and why governments generally fail to live up to the standard across the board, and not just on safe potable water or washing hands campaign or diarrheal diseases. We ought to look at the entire life cycle.
I wonder, though, Dr. T, why it is that some of these countries also don't see the link between their grand plans around economic growth and prosperity and healthcare, because a healthier population is able to do more in aid of a thriving economy, no?
Absolutely. And the non-discrimination element, which is a key principle of the right to health, is that everyone should be able to access not just health facilities as in physically access them, but they also ought to be economically affordable as well. What tends to happen in many countries is that because they have a large working class, which has medical insurance, medical aid, they are able to somehow supplement what the government would be having to give them in the public sector. And so the public sector is then allowed to not thrive, because then a lot more people are paying tax and are paying into these private commodities and private portfolios for health. And so when you look at statistics, they all say, oh, no, the population is doing very well. But if you look at the nitty-gritties of who's doing well, you will see that poor people are still being left behind. Rural and peri-urban communities are being left behind. People with disabilities, the LGBTQ plus communities with specific needs. And if you look at issues around palliative health care as well. So on the one hand, for economic benefit, they understand that populations have to be healthy and well. But if you have 12 million people unemployed, I don't think the private sector is worried about whether or me or you kill over and die at work. There are many people waiting to fill those posts for far much less than we cost. And so that's the reality, and that's the politics of health.
How then do we challenge or turn around those very politics of healthcare?
I think what we need is strong national frameworks for accountability, but also for monitoring. When you have governments which, of course, report on a national level, a minister will often give statistics of how well and how healthy the country is. We have to have regional mechanisms as well of accountability, but we also have international mechanisms of accountability. So within the United Nations, for example, there's universal periodic review, where member states are expected to be given a list of questions that they answer on particular themes, and ours has been on health previously. So it's important for civil society to do its job and to be allowed to do its job of holding the government accountable. And what you will find, why we often say we have to defend civil society space and the ability to participate in governance, is precisely for this point, is that when there is no civil society that can thrive and hold elected leaders and duty bearers accountable and give shadow reports and give what we call often the reports of where the rubber meets the tire, is that you then have what we often say glorified reports. So accountability and transparency are very important to change where we are at the moment.
Things are worse off on there for people who are in conflict zones. Thinking of the people in Sudan who've endured a war that's gone on now for about 3 years. You look at Palestinians in Gaza who've also been denied access to basic health care. What does that say about the global push, especially by the people in power, to make sure that people who are enduring such horrors are at the very least able to go to a hospital where they can be given something as basic as a painkiller, where they're able to be in a surgery, an operating room, and given the necessary drugs to ensure that it is less painful than it is, or at a very basic level that it's a sterile environment?
And often we talk about humanitarian settings and crisis zones, and we live in a world now where those are not just isolated or issues that get resolved quickly. And my frustration, and I say this even at the UN all the time, is that we are in perpetual humanitarian crises for many of these regions. And so to what extent do we need to start thinking about peace and security and what actually we need for peace to actually be sustainable? The other important thing is we have to talk about the fact that capitalism by its very nature is extractive and violent, right? There isn't a lesser form of capitalism. And when you look at the kinds of wars that are being waged around the world, it's around minerals, it's about oil, it's about natural resources. And so we have to be honest that the reasons why we are where we are at are about capitalism and people wanting to enrich themselves, whether as blocks of countries, whether as individual countries, but ultimately these wars are being fueled because there's a particular greed around capitalism. From a right to health perspective, there are many in terms of international human rights laws and standards and consensus documents, international humanitarian law, that is very clear that no health facility can be targeted or attacked. And health workers are people who are also enjoying special protection. And any attack or targeting of health facilities, healthcare workers, actually goes against international human rights law and humanitarian law. And ultimately, what we do see now is impunity and a lack of accountability on a scale we are yet to even fully quantify, I think. And what the current genocide that's unfolding in Gaza is showing us is that when you fail to hold others accountable, the spillover is immediate, where you have other countries as well who are also now, questioning the international human rights law and basically what we have as a multilateral system that is meant to support and protect the most vulnerable.
And just lastly, in terms of the citizens, especially the young, becoming actively involved in shaping issues such as healthcare policy, how well are we doing? Because, for example, when the South African Parliament gives feedback sometimes on public participation processes followed before certain things become law, when you scrutinize those numbers, they aren't necessarily where they should be or quite impressive. let's speak to the importance of people playing that role in shaping the laws of their country.
And the law and legislative, frameworks and the process of lawmaking is not easy. So we ought to embark, I think, on a wider public information and education campaign that actually explains to people how a legislation can be amended, why it's important for its amendment, and what was missing before, perhaps, and why we need to progress in a particular way. And that lack of public education and information, I think, for me, is not an isolated issue. It forms part of that atmosphere where civil society's participation and their access to spaces of governance and global governance, even on a national and regional space, is being shrunk. And so we have to really embark on education and training. What I can give an example of to try and get young people excited and engaged is that in October this year, I'll be addressing the General Assembly in my capacity, of course, as the UN Special Rapporteur. And they have decided to actually have a right to health art exhibition and have young people interpret for themselves what the right to health means, what the vision for the right to health is, and what the literal contextual issues they are facing. And I think that's one way of being creative to try and get young people engaged in what issues often seem like, the diplomatic language can be quite alienating. The UN space itself is very, daunting. And so one of the ways is to use multimedia and other platforms to engage and spread the word.
Dr. Tlaleng Mofokeng, United Nations Special Rapporteur on the right to health. Good to have your time on the SABC.